Join us now for Health for Life, brought to you by Hamilton Healthcare System.
Today we're talking with Claudio Leyssens. Claudio is the Quality and Education Captain at Hamilton EMS. Claudio, thank you for joining us.
Glad to be here.
So today we are going to talk about the Hamilton Healthcare System and the EMT and AEMT programs.
Yes, so the EMT and AEMT programs are fairly new, especially the AEMT program. This will be our first go-around, so we're very excited to offer it to the community.
Awesome. And so what is the difference between an EMT and an AEMT?
Well, an EMT is the entry level in emergency medicine. So these people will learn basic patient assessment, how to operate a vehicle, and that kind of stuff, where the AEMT is a little bit more into patient care, such as starting IVs and a little bit of advanced airways and that kind of stuff. And it's the stepping stone towards paramedic.
How long would it take them to become an EMT?
Depends on what school you go to. We do it in about 6 months, give or take a week or so. And then the next step will be AEMT, which takes approximately the same length.
Wow, okay, that's amazing. And what kind of duties are expected for EMTs and AEMTs to perform?
So an EMT and an AEMT is part of a team. So the big thing is working as a team. They will do anything from washing the vehicles, maintaining the vehicles, to patient care, lifting patients on stretchers, splinting broken bones, starting IVs, assisting with airways, and all those good things that the nurses do in the hospital, we do on 4 wheels.
I'm sure that's very rewarding work.
It is an amazing job.
So what is the cost of the program?
Well, the cost of the program is $1,800 for the EMT program and $1,800 for the AEMT program. We offer a convenient payment plan where you make payments as you go during the course.
Have you seen that the field is continuing to grow?
Oh, absolutely. There is a nationwide shortage on EMTs and paramedics, and it's an amazingly fast-growing field.
Some of the more specifics of the program, what are the qualifications for this?
Well, to enter the program, we try to keep it as simple as possible. You have to be 18 years of age, you have to have a valid driver's license, and you have to be able to pass a background check. These are also the requirements that the state office sets so that you can apply for a state license. To enter the AEMT program, we add one more condition to that, and that is you have to be an EMT. The EMT program is the start. The AEMT program follows up on that. So you have to have one step to progress to the next step.
And are these courses made to be shift-friendly?
Absolutely. We're doing them on a shift-friendly rotating schedule. So that means every third day we meet, and then every third weekend we meet on a Saturday. We do not meet on Sundays.
All right. And then what are the days and hours of the program?
We have a rotating schedule. Now, the hours, since we do the classes in the evening, it is from 5 p.m. until 10 p.m., and then on the weekends it is 8 to 5.
Awesome. And then where would these classes be held?
They will be held at Hamilton University base off of Elkwood Drive. It's right behind the hospital.
On average, how many people would be in each class?
We take up to 20 people in class. We have seats for 20 people, so we will take up to 20 people in class.
You might not be able to get in if you don't sign up soon enough?
That is a possibility. It's a good idea to sign up as soon as possible because classes are starting soon. They are filling up. I have a whole list of candidates already.
People that are interested need to get on this.
Absolutely.
And what hours do EMTs and AMTs usually work once you're actually working as that?
Well, that varies. We offer 8-hour shifts, we offer 12-hour shifts, and we offer 24-hour shifts. That is us. Different services offer different hours, but the standard is either 12 or 24-hour shifts.
And, people that take this program, have you seen that they get placed in job positions right after graduating?
Yes. I've seen a lot of students being hired while they're still in class where they do such a good job that the service says, okay, we keep you a job the moment you graduate. You come on board. We got you.
So could this possibly be used as a stepping stone for other careers?
Absolutely. I have several former students that are now physicians. One is a surgeon and a couple of general physicians, and I know of another student that is now a CRNA. So a lot of people in the healthcare use the EMT program, the AEMT program, or even the paramedic program as a stepping stone to further their career in healthcare.
Well, so this can really just lead you anywhere.
It absolutely can. It absolutely can. A lot of people, a lot of courses love having former EMTs in class because they have a basic understanding of patient assessment, a basic understanding of anatomy, and a lot of times get preferential treatment, so to speak, as to getting into programs.
Based on the experience that you've had in the field, what are the kind of patients that people should expect?
A huge variety of patients. Every day is different. You never know what the day is going to bring. Our crews run calls from heart attacks, stroke, and Hamilton now is a stroke center. Hamilton now has open heart, so we're hammering very specifically on those skills, to car wrecks and falls and anything and everything in between. Sometimes we deliver babies in the field. All of this is being taught in these classes. And the further you go in the program, we teach you a little bit in EMT, we teach you quite a bit more in AEMT, and we teach you a whole lot more in paramedic. So all of these skills that you learn are going to be immediately put to work in the field.
I mean, these skills are incredibly important. And as they go on, they're just going to learn everything.
They pretty much learn everything, yes. We start with EMT just a little bit. Here you go. We talk a little bit about heart attack. And you come to AEMT and it's like, okay, now we're going to build on the information you already have. And we do a whole lot more. And then you come to paramedic and it was like, okay, now we're going to bring you a whole lot more on the information you already had before. And then if you are lucky to work for a service such as Hamilton, then you deal with an open heart surgery center. Well, guess what? You learn even more on the job training about that. So the bigger base you have, the better off you are when you start to work.
Yeah, and no matter how much somebody learns, there will always be kind of unexpected situations, right?
Yes, there is always that curveball that you go like, okay, that's new. Never heard or seen that before. But that's what we do. That's what we train you for, to deal with those curveballs where you go like, that was difficult, but I figured it out.
So what should our listeners do first if they are interested in the EMT and AEMT training programs?
Contact us. Classes start soon, so the sooner you contact us, the sooner we can get you on the list for a class. You can contact us either on the website, hamiltonhealth.com/EMT, or you can email us directly at emsprogram@hhcs.org. Either one will work, and we will contact you and give you the soonest available date that the class starts and what you need to do to get into the program.
Awesome. Well, thank you very much for joining us on the show, and I'm sure everybody really enjoyed the information you gave us.
It's been my pleasure.
Once again, for more information on Hamilton Healthcare System's EMT and AEMT training programs, visit hamiltonhealth.com/EMT.
Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.